Thank you. Any comment on that? We're going to deal with those condo rules. Anyone want to venture a thought of that? Okay, here's another question or comment.
I just wanted to comment on that. Where I live, I can't have a clothesline, so I have 2 drying racks that I got from Bed Bath & Beyond, and I hang my clothes on that, and it works just fine.
Rack those clothes. All right. Yes, comment. Yes, Kathleen.
There's one thing I did want to mention that I forgot. We have a 70-year-old house, and we are actually taking advantage of this Sonoma County Energy Independence Program now with new windows. And I encourage everybody, look into it. And if you've got, get that energy audit on your house and make those changes, and you reduce your carbon footprint.
Okay. Are there any other questions or comments? Over here and get out of the feedback range to speak.
Hello. Yes, I would like to, I'm a member of Move On, but I'm wondering why Move On has not endorsed single-payer system for the healthcare reform. I strongly support that option, and I heard that the public option, of course, is the second best, but it's still, in my mind, it's the second best. And I read over and over again, even with public option, and quite a few people will be without insurance. So if somebody could address that.
Yeah, I personally think that a serious mistake was made by everyone from the Obama administration on down in not having invited single-payer advocates to be part of the national discussion on this. For one thing, it deprives this argument of the radical flank effect, as we like to talk about it in sociology. There wasn't a left-wing position. The left-wing position became the public option. You don't want to be in that position, even if what you think, realistically speaking, that was the only likely plan that was going to get through Congress in this year. I think there's probably a bit of a false dichotomy going on here between single-payer and public option advocates that's gotten a little extreme. From what I understand, there are probably few, if any, pure single-payer systems in the world. Even the French system, the British system have kinds of insurance that would cover what our Medigap insurance covers in Medicare, for example. None of these systems are totally pure single-payer systems. So we don't need to set ourselves in opposition on this. I agree in the sense that I started out arguing for single-payer myself 16 years ago. And I debated the medical director of Kaiser at the School of Nursing at Sonoma State University with me taking the single-payer position. I'm sympathetic to it. I think we should have had a good argument about it in this whole debate about the health care plan. And I think we ought to work hand in hand to get the strongest possible position that we can in whatever health care legislation emerges. Are there any other comments on this?
Yeah. Change the subject.
Change in the subject. Okay, fine. Lynn Hollander.
Yeah, I'm Lynn Hollander from Sebastopol. And I'd like to know if there's any discussion and possibility that Sebastopol and Santa Rosa will set up a program like Berkeley's in terms of solar, where it would just, the county or the city lays out the cost of the system and you pay it back monthly with your utility bill, because that seems to me the best way to make it affordable for people in the county.
The Berkeley plan, any comments?
Well, the Energy Independence Program does that with the property tax bill. However, I do want to mention there's also a pay-as-you-save system, and pay-as-you-save is linked to the utility bill, and there are many things we could do with water. So I am very anxious to have both. both the Energy Independence Program and a pay-as-you-save program, because the Energy Independence Program is generally limited to things that are attached to the home. And for example, storm windows in historic homes, storm windows make a lot of sense. I have a neighbor with a beautiful, beautiful Victorian house. She has plastic storm windows that are very, very aesthetic. They're placed inside. She can pop them in and out easily so she can open the window. She has lace curtains between them, and it was only $600 for her whole home. She's going to go back and get some double, for some areas where she's going to put a double storm window in. And that could be a pay-as-you-save program, whereas the Energy Independence Program, as it is currently written, I don't think will cover that. So that's an exciting way to go. So thank you for bringing that important possibility up.
Thank you. Are there any other comments? We're coming right up on the 1 o'clock hour here. Seeing none, I'd like to thank our speakers today for coming down and talking with us, sharing their ideas, their insights, and their advocacy.
Hi, I'm Carolyn Andrews, and we're organizing for healthcare reform here in Santa Rosa. We're working for Organizing for America. We're organizing for healthcare reform because we need healthcare reform that includes 3 principles. It should reduce costs, it should guarantee affordable care for all, and it should also guarantee that people have choice in their health care, both doctor and plan.
I absolutely support public health care reform. I support President Obama's plan, and I absolutely want the public option. I'm one of the 46 million uninsured Americans. I actually have to travel to Mexico for my dental work, and we need to have this, and we need to have this now. I shouldn't have to go to another country to be taken care of. I should be able to be taken care of in my own country. Thanks.
I'm here because I'm a healthcare provider, and I witnessed denial of healthcare to the patients that desperately need it the most. And I really want to see a substantial healthcare reform, and I want to work for that. Thank you for letting me speak.
Hi, I'm Laurel Michaels, and I'm working here today with Organizing for America, and we are working to help pass President Obama's reform for his 3 principles of reducing costs and also guaranteeing choice for every American and ensuring quality care with a strong public option. And we are just so happy to be here. We've got over 75 cards to go to Senator Boxer and Senator Feinstein, whom we really need to get on board and pass this legislation. Thank you so much.